Good morning, good evening, good afternoon to wherever you are dialing in from, and to our lovely guests and visitors to this panel this morning. Thank you so much for joining. I'm going to introduce them both in a second. So for those of you that are visiting from our Global Community and Nutrition Network, thank you for coming. It's such an exciting time. I think we're live streaming through the other organizations as well, maybe. So we're here joined by two wonderful people. I'm Jayne Bullen, Managing Director of Nutrition Network and Strategy Lead at the Noakes Foundation. This is Jana Retief, the Foundation Manager at the Noakes Foundation. And then we've got Nikki Wire, who is a community coach for Eat Better South Africa. Thank you both so much for being here with us. It feels so exciting to just get this particular really important piece of work out more, talked about more. And then the idea behind this morning or this afternoon or evening, because a lot of you are coming in join us from all over the world, is to just bring a little bit more awareness and attention to the Nutrition Network community around the work that the Noakes Foundation and Eat Better South Africa does. Now, many of you that are here from long ago and that joined us from the very beginning of our days as the Nutrition Network know the whole story. And some of you don't, and you just know Nutrition Network and you joining from an educational perspective. And we're not going to tell the whole story today because we want to share that next week. But what I do want to say is, of course, that we came from, for those of you that don't know, we were birthed by the Noakes Foundation. So many of us, including myself and Candice and Tamsin, who are on the Nutrition Network team, were originally working at the Noakes Foundation. In fact, as well as Dr. Neville Wellington, Dr. Hasina Kaji, they were on the board back then. So actually a large part of the team and our vision behind Nutrition Network comes from this place and this incredible nonprofit, the Noakes Foundation. This is where we were born. This is the vision behind our work, was always to support and we hoped to fund the Noakes Foundation in entirety. But of course, they've gone off and done such amazing work since then and over the years that we're not a majority funder even anymore, which I would like to change through the incredible support of our community. So for those of you that don't know, that's the kind of short version of the backstory. And also that the majority of our ownership and shares and profits go to the Noakes Foundation, and particularly with the mind of those heading towards Eat Better South Africa and the incredible work it does in local communities in South Africa. So I would love to just hear a lot more about this, of course. Jana, I'm going to start with you because I want you to just give us a roundup of what's going on at the foundation at the moment. What have your highlights been? What's your research focus? And yeah, just give us a little bit of a 101 of what you've been up to this year and what's coming.
Okay, thanks, Jayne. Before I do that, I just want to comment on something. It was so nice now listening how you talk about kind of the inception of the Nutrition Network. And I mean, the vision behind the organization to help fund the Noakes Foundation, which is a nonprofit, as you mentioned. But I almost sometimes, when I think back, Nutrition Network for me personally was also a big stepping stone into the foundation. As I'm sure you will remember, that's the first time we met was at the very, very first Nutrition Network training in Cape Town, which was an absolutely incredible experience. I mean, I just remember I was I was dumbstruck when I met Prof. I didn't even know how to speak with him. I just said, hi. And all of you guys actually at that point already, just knowing how much you've managed to achieve in such a short amount of time. So thank you so much for just reminding me of kind of where it all started. Wow. So, I mean, yeah, you asked me a difficult question. Highlights for the Noakes Foundation.
Well, to give you time to think about that, I just want to reply to that. And thank you for the reminder that actually it was this incredible crossover time that you came in as we started the Nutrition Network. And of course, we'd been looking for you for a very long time. And it just gave the foundation the opportunity to grow in one direction. So it was this incredible crossover. And it feels like it's come full circle with us having just had the World Nutrition Summit. So thank you for that incredible reminder. And look at where we are. 8 years later, 7 years later, many years.
Well, oh gosh, I don't know. I think
7 or 8 years.
I started. Yeah, I started March 2018. So if there's anyone on here that can do math, I can do math on Excel and on my phone. No, no, don't
So
ask me like this. So yeah,
even though it's almost 8 years later, here we are as
yeah.
two profoundly standalone and growing organizations in the areas we're meant to be growing, or three when we talk about EBSA. So let's go there. Let's hear what's happening, what's going on the ground in the foundation today, and where you're heading.
Well, I think definitely when you now spoke about highlights of the past year, I think we definitely have to start with the World Nutrition Summit, without a doubt. Uh, yes, it was, and I know you know this. Getting the World Nutrition Summit as an actual in-person event took years, quite literally 5 years longer. For those that might not know the full story, is I think it was a big towards end of 2019, beginning 2020, Nutrition Network, the Noakes Foundation, and Eat Better South Africa. The teams came together. So remember, it was at the V&A Waterfront in Cape Town, and we had this amazing brainstorming team building session, and we said we are going to do it. 2020 is our year for the in-person conference. That's when we decided on the name and everything. We envisioned for it as a conference and as a summit. And then, I mean, we all know what happened. So 2020 came, and unfortunately, the event that we envisioned did not realize. Since then, the Nutrition Network, I think, hosted several World Nutrition Summits as virtual events, which was hugely successful. And, and then I think it was last year sometime we started talking again, well, it's been now a few years, people are traveling a bit more. So it's now really time to get this conference where we really envision it initially. So that was a huge, huge highlight for us. It was absolutely amazing getting to meet so many Nutrition Network lecturers, Nutrition Network practitioners, everyone that's part of, I want to say, like the family of the Nutrition Network, the Noakes Foundation, and Eat Better South Africa. It was just amazing to have everyone there. The lectures are also now available on the Nutrition Network platform. If anyone wants to go, I think it's available for purchase. And if you were at the conference, you also get access to this for free. So yeah, that was definitely one of our biggest highlights. And then, I mean, Eat Better South Africa, there's so much I can say about that. So I'll say a little bit, and then maybe Nikki can share from her perspective and her experience. But we've been incredibly lucky to be able to fund Eat Better South Africa community projects, specifically at a local clinic here in the Western Cape, because of generous donors and through the Nutrition Network. So thank you so much for your support, ongoing support. And we are doing an ethics approved study. So we'll have the results probably towards mid next year. So by the next summit next year, which we're not going to go into too much detail now, but it's happening, we'll hopefully be able to share the actual results from the study. So that's definitely also a highlight for us, being able to do that, knowing we'll be able to publish our amazing results that we're going to have. But I think, Jayne, maybe if I can hand over to Nikki, I think she can share a little bit more about the program, maybe also her incredible inspirational journey that she's been through and how she came to be part of our team. And also, I have to mention the Eat Better South Africa training that's available on the Nutrition Network, which is an outline of this program. And the sales from that course directly supports our Eat Better South Africa programs. And I know there's a sale on with Black Friday, am I right?
Yes.
Yes,
So
yes.
I want to talk quite a bit more about that training later. So maybe we jump to Nikki. Nikki, I mean, Jana's introduced you, but I just want to add, honestly, I was the first 2 times I met Nikki, I actually shed tears. And I'm not an easy crier. Like, I'm a bit of a sort of keep stoic at work. Obviously, other times we won't discuss that, but really, Nikki's story has had the most profound impact, I know, on myself and on many. So just tell us how it happened and how you landed in this role that you're now in as a community coach within Eat Better South Africa.
Oh, thanks, Jayne. Hello, everyone. So my story began 6 years ago. So when I arrived at the clinic, I was in a wheelchair actually, and I just woke up one day and I couldn't walk. So At that time, I wasn't diagnosed with type 2 diabetes as well. So, anyway, 3 years down the line, I also discovered that I had, that was the time that I was diagnosed with type 2 diabetes and hypertension. And I also fell into depression, and I was also overweight. That's when I also met with Eat Better South Africa coach at the local clinic. And then she invited me to just try it out and change my lifestyle. But at first, I didn't listen. I still regret it up to now. If I had listened, maybe my story would have changed 3 years ago. But then last year, I also met again with a Eat Better coach, and then she advised me if I can try to change my lifestyle. And then I was like, okay, I'm gonna try, but I'll see. Then I stopped again, and then finally this year, around earlier this year, I met her again, and then she invited me over. But that time I had already lost hope because I was supposed to go for the OP, and then it was cancelled, so I couldn't go for the operation for the spine. So then she asked me if I want to. Then I was like, okay, this time I'm gonna try. I'm just gonna give it a try. But if it's not working, then I don't know what I'm gonna do now. And at that time, I didn't have anything to lose. So I came for the first session. Then I met Jana. She was like, hello, Mama. I was looking old and frail. And then, yeah, the first session, it went well. Then that's when I saw the sugar demo. That was like a wake up call. And I knew at that moment that I really needed to change. So we went home. I was here with my family, my mother and my father as well. So we went home. Then we discussed, and then we like, okay, now we need to change. The first week, the second week, the inflammation started getting better. I was able to like sit for an hour, and then we're like, wow, this is working. The third week, when I came to the clinic for the sessions, I was on crutches. Still couldn't believe it. But the fourth week, when I came, I was walking without crutches. I was like completely healed. To me, it was being healed because it's something that I haven't done in like 6 years. I haven't been walking for 6 years, and I have been in pain, and I have been more of a celebrity at the clinics as well. Like most of the doctors and the nurses, they knew me whenever I would come. Even at the pharmacy, they would know my medication as well. So the fourth week when I met Diana, she couldn't even recognize me. She was like, how are you? Is it your first time? Yeah. She was all being Yana. And yeah, that is when everything changed. So I started working within 4 weeks of changing my lifestyle. And Eat Better South Africa has been like on my mouth ever since then. Like I could just pioneer. And then when she invited me over to if I wanted to be a coach. And also when I met Diane, she was like, do you want to be a coach? I was like, yeah, I want to try. Then Yana introduced me to Nutrition Network, then started with the courses. And here I am waiting for another Nicola to come. But actually, I also met another guy yesterday. He is in a condition that is same as mine. So when I spoke to him also, he was like he's willing to change. So I'm also looking forward to working with him and see if his story will change also.
Wow, Nikki, I think you're going to forever be known as the person that came in a wheelchair and left on your feet. There's many, many
He said the
stories.
miraculous.
Like, so over the years, we've heard of South Africa, we've heard it all. There are a lot of babies that EBSA is responsible for. There are a lot of diseases that have been reversed, a lot of killers that have been shed, many, many things. But I think you're the first person that's got rid of a wheelchair and crutches. So that is really like, it feels like a landmark. Thank you for sharing that. Wow, just wow. So tell us a little bit about the work that you actually do in the Dunoon Clinic and some of the stuff that happens there, some patients that you've got to know since you've become a coach. And Jana, add into this, please, as
Okay.
well. Yeah.
Okay, so being an EBSA coach at Dunoon Clinic has been life changing. Also on me, on my side, and also on my patient side, because we deal with patients who struggle with type 2 diabetes and who also suffer from hypertension. And also, we also have patients who HIV positive and others who have TB. So others are just coming to improve their health, and the others, especially the TB ones and the HIV ones, they are here to also improve their viral load. So, which is something that is amazing, and also to see how one person can change within a week. It's something that is amazing. I have like 3 patients that I saw, and when I checked on their vitals, the first one, I think it was around, the sugar was around 31, 32, and then they had to be sent to EC. And then when they were sent over to me, within like 3 days, the sugar was on 13. And then within a short space of time, the numbers were now going lower. And also, there was another one that I saw last week. When he came, his sugar was on 23. And then now when he came, it was on 6.5. So that is something that is amazing. And to see what their lifestyle is actually doing to people, it's something that is amazing. That is like, it keeps on encouraging us to come every day and help everyone who is in need of our help.
Nikki, I think that's such an important point that you've raised here. And I want to ask Jana to talk a bit more about it, which is for our global audience, just so you understand the context that we're working in here. In South Africa, the last data I saw, 83% of South Africans do not have access to private healthcare. And it may have changed. So it may be even more now. This is a couple of years ago that I was looking at those numbers. So that means that, we've got about 60 plus million people in our country. So we're looking at all of our statisticians and mathematicians out there, please correct me, but we're looking at a good, many, many millions of people that have no access to private support in healthcare. And the difference in our country, which is, it's quite unique in South Africa because we have the highest Gini coefficient in the world. We have the highest income disparity, is that we have access to world-class medicine and healthcare if we can afford it and if we have private healthcare. And if you don't, it's like a big leveler in our country. I always think if you don't have a car and if you don't have private medical aid in South Africa, it sets you apart in terms of your access. And if you don't, particularly things like non-communicable diseases, I want to say there's very little care, but to nearly no care. But that's not entirely true because there's so many incredible clinicians working in local communities. But what really happens is people that are seen as diabetic, and particularly the patients that come to your clinic, in my understanding, are seen as kind of hopeless. They've kind of almost sent their lactus as like a moral support. And what this is doing is giving people their health and their lives back, which is not expected. It defies, of course, medical knowledge in general that we're seeing diabetes reversal to this level and, wheelchair reversal and mobility return. But really in such a income deprived and fund deprived environment, this, in my understanding and belief around the Eat Better South Africa program, is a very articulate solution to offset the health crisis that comes with poverty in our country and in others around the world. Jana, do you want to talk a little bit more to that, just in terms of what's happening in the public health game in South Africa and what you see?
I think you've sketched a really good picture, and maybe also just to explain how the system works. Like, just, it's not like someone can make an appointment and go to the doctor. It's not as simple as doing that. If you want to see a healthcare provider, you need to get up very early in the morning and you have to go queue outside of a clinic. And often that means queuing from 5 a.m. in the morning to make sure you can get into the clinic. At that point, a patient might only then be either given an appointment date or they will be triaged. And that's actually often where some of our participants come from. So through the triage room where people are, their blood glucose are checked, their blood pressure checked, their weight and so on. And from there on, they often actually get sent to us. There by Nikki, where she then talks about them depending on their results. And at that point, you then you get a referral or you have to come back. And when you visit one of the clinics, and I mean, the clinic where we work in, I just have to say is actually incredible. It's a very good, very well operating clinic. The doctors there are absolutely wonderful. Like I almost feel like I need to give a shout out to every single staff member at that clinic who's been working with us, who's been so incredibly supportive, and their passion for their patients. And they're not blind to the systemic issues and inequality within healthcare, but they are really doing their best within what they can do. And often just to get a folder or a file, like there's posters on around the clinic, like the average waiting time is 3 hours just to get to the first point. And that is unfortunately the reality. So it often takes a lot of time. So what happens sometimes, people don't go to the clinic when they're a little bit sick or a little bit ill. People tend to wait till they're really sick or they cannot, go on anymore. And I think sometimes that's what's happening then when people arrive at the clinic with blood sugar readings of 33 or in the 20s, is because they because of circumstances they weren't able to get there earlier until their body really went like, well, kind of cannot go on anymore. So I think that is where Eat Better South Africa plays a very important role. And I mean, even with private healthcare, let's be honest, doctors have I think 15 minutes, if you're lucky, to see you, to get you through their office, to check you out. I think, and I'm speaking under correction, but I think within the public healthcare, it's about 6 minutes per patient. And I mean, you can be as passionate as you want as a doctor, but you cannot do everything in that short amount of time. And Eat Better South Africa is really offering that support system to the staff at the clinic to say, well, we are here, we can help. How can we help? What do you need? There's a amazing dietitian also at the clinic, which we are working with and supporting each other, but she's not there every day. So it works on a rotation basis. So even if a patient needs to see a dietitian, it's not like you can go to the clinic and then say, I need to see a dietitian. You'll be placed on a waiting list, which then takes another couple of months often, or in certain cases, if you need to get a procedure done, it can take years for you to get on top of the list, to get certain procedures done. And Eat Better South Africa really helps to kind of close that gap and to help people get needs specifically related to metabolic disease like type 2 diabetes, hypertension, obesity. Like Nikki mentioned, often in cases where participants might have TB or HIV, they come with different needs. But, for us, it's like when they gain weight, we celebrate, because often, those participants actually struggle with weight loss. And, it's just, I almost sometimes feel like I wish I could invite the whole world to come and see the program, and just to see like with how much you can do with so little. And that's again, I want to say thank you to everyone that's been supporting us. And please, if you want to learn more and support us by purchasing the Eat Better South Africa training, those funds come to us, and that really helps us, to be able to get more coaches into the communities and do more outreach work.
So I'm going to add on to that, Jana, which is, of course, that, I mean, you don't have to buy a training. You can just donate to the Noakes Foundation, of course. But this is a kind of creative way that we've thought of many creative ways over the years, and certainly in my now nearly 11 years of working in this game, trying to fund Eat Better South Africa and the foundation's research. And this is one of our most eloquent ways, is actually the Nutrition Network. It was really created as a way, partially out of just absolute burnout of trying to fundraise for the Noakes Foundation and Eat Better South Africa, and kind of going and asking people for money was so unsuccessful. And we realized that actually creating something really meaningful that could train and support. Initially, it was created for our local community. And of course, now we're this large international organization, which we never expected. So Thanksgiving week, let's just talk about that. I mean, I would like to give thanks. And this is kind of our way of giving thanks, is by saying we're going to just dramatically discount our courses so that whoever can get access to this information will and should. So we would probably never say no to somebody doing this training at no cost. And I know we fund quite a lot of people in the local community to do this and many of our other Nutrition Network trainings. But huge thanks as well to just back in the beginning, you know, when you're talking about state clinics, it's like we met Yodia Sampson at the very beginning before Eat Better was born. And she is actually the original brainchild behind our sugar demo. It was her idea and her kind of vision and passion, and she still does it, and we've kind of taken it on and made it our own. But huge gratitude to her for her vision for communities and her absolute love and passion for local communities, and her own journey, which we should bring on and talk about again and again as well, of how she just changed her own life through this way of eating and this lifestyle and the work she does. And Eat Better South Africa really sits on the kind of the shoulders of many giants and many community giants. So back in those early days, the people that used to come in, you know, we've been through so many different local communities. And we did this once in Villiers-Dorp, which is a small town in the middle of kind of, I don't want to say nowhere, but in the Winelands district outside, a couple of hours from Cape Town. We got it down to about 12 Rand a day, which is, oh gosh, in US dollar terms, we're $18 to the Rand. So it's about 80 US dollar cents a day of food. That was how much people were spending on their daily diets. And it worked as well as it does today with bigger budgets. And, you know, the data, when we look at the data and the research, which I would like us to talk about a little bit next, it's not that different to the incredible data that Virta Health is putting out, which is this very high-end application of, you know, this lifestyle change. So Eat Better South Africa has impact, and it actually works. So maybe let's talk a little bit about the research that Eat Better is doing and the research that overall that the foundation's doing at the moment and has done in the past while that's worth mentioning, which is also what the money that, you know, what is funded through hopefully a lot of the money that we make at Nutrition Network and all the money that the Noakes Foundation makes goes into ultimately research and education and community work. Tell us a bit more about the research.
Before I do that, Jayne, I just always also feel like you've mentioned the Yodia, but you also need a shout out. You and Dr. Sina Kaji, who was part of the inception of Eat Better South Africa in 2015, for the exact reason that you mentioned now. That the low carb keto banting, as we know it here in South Africa, lifestyle got so much critique around it's an expensive lifestyle. How can you expect South Africans to eat healthy or eat this way? You know, you can't eat healthy on a budget type of idea. And I mean, that is how you ultimately then founded Eat Better South Africa. So just thank you to you two, and just a shout out to you and Dr. Sina. And I mean, Eat Better South Africa, if I'm correct, it was founded in 2015, which means it's 10 years old this year, right?
Oh, it is. We should have had a party.
Yeah.
Wow, it is 10. Yeah.
So it's 10 years, which is absolutely, I mean, it's incredible. So yeah, just wanted to put that out there too. And I mean, the number of people and communities and lives that has been touched through this initiative is just, I don't think one can really quantify the number of lives that has been kind of touched by the ripple effect at the end of the day.
I've got a story about that. Can I tell it quickly? My son went into a little, you know, he was a preteen, and he went into this little like group that was sort of for preteen boys. And this was a few years after one of the interventions we'd done in Ocean View, which was our first one. And there was a lady there, and she recognized me and I recognized her, but I didn't entirely because she was so much thinner. And then we worked out where it was from. And she said, I've got to kiss your toes if I could. My husband lost 42 kilograms after I did the program. And I was like, what happened? So he had taken on the lifestyle. And that's the whole thing that we worked out over the years, of course, is that it's not only really about the person that does the program, especially in local communities in South Africa, because women in particular have such a big ripple effect on their community and they cook for so many, that it's around 11 people that are impacted. I'm not going to say like that we can quantify that and have like big data sets of the medical data around that, but we think that around 11 people per person that does our programs are impacted. So you change one person and you change a community, right? So tell us about the research that we're doing to actually finally, now that we've built what we know to work, we're converting it into the science. The science is catching up. We're now going, okay, we've got to really get this out there, published and real. Give us a bit of info on what you're doing. I know you've touched on it earlier.
Yeah. So, I mean, we at the moment at the Noakes Foundation, we've got several ongoing studies looking at different type of, I would say, metabolic or nutritional interventions. Just out of interest, I'll mention a few. So we're currently doing a study looking at pork consumption and its effects on metabolic health markers. Next year, we'll be doing a study looking at egg consumption. We've done we're in the process of finishing off a study looking at hypothyroidism, and that's led by Georgina Pujol-Busquets. She's currently on maternity leave, but she's coming back next week. So we're very excited about that. So that's another study we're doing. We're also doing another project looking at a digital intervention through a health insurance company, which is also showing some promising results. And then one I haven't mentioned, Jayne, which was also obviously a highlight of this year, was when we did the evaluation of the whole body health program for the Nutrition Network. Yeah. So, I mean, I don't know how you guys shared the results yet or not, but I mean, what I can definitely tell the audience is that there were some incredible results from that project, which just shows again how nutritional intervention can really impact your life, and not just, weight, because the whole body health program specifically looked at several health markers, and also looked at things like stress, things like sleep. And it was just clear how that project had a positive effect on the participants. So I think that definitely deserves a shout out. And then obviously, like I mentioned, the Eat Better South Africa programs that we've been doing. This particular program we're doing at the moment, I quickly try to open some things here at the back to see if I could share some of it. But just an idea of what it entails. So we recruited participants at the beginning of the year, and then we did baseline measurements. So that would be blood glucose, blood pressure, weight, waist circumference, HbA and HbA1c blood testing, of which Nicola is one of the participants, by the way. So just I want to mention that too. And then we've put all the participants through our 6-week program, which looks at different types of topics. So we start off with the sugar demonstration, then we talk about metabolic health, what is metabolic syndrome, what is diabetes, because often people get diagnosed with diabetes or hypertension, but they don't really in practical terms understand what does that mean in my body. So we focus a lot on what is insulin resistance, prediabetes, what is like HbA1c and all of those things around that. And then we look at things like, how do you manage social situations? How do you eat healthy on a budget? And at that point, I always also like to say, and I think I heard you the first time say, Jayne, we call Eat Better South Africa, not Eat Perfect. So, looking at the low-hanging fruits, just going from 4 teaspoons of sugar in your coffee to 3 to 2 to 1. I mean, that's already improvement. Starting to cut out all the sugary drinks, all the added sugars, processed foods. And that's why the sugar demo is so impactful, because people do not realize that there's sugar in savory products, as an example, or that it's not just the added sugar that you consume, and how that works. And then so the participants went through this program. We also then again did post measurements, And we are now doing every 3 months for up to 1 year. We're doing measurements while we continue to provide support to all of the participants. We have monthly sessions where we also look at other type of things like sleep, mental health. Movement is a big thing, and if I say movement, I don't mean exercise and going to the gym. And Nikki is very good at this. I'm surprised she hasn't told us to get up yet. She's very good at telling us, wait, stop, pause. Everyone get up and move your body. So, yes. So looking at all of those things, while continue to provide support, we also provide like some green list vegetables to the participants alongside with recipes to try and encourage them to explore new ways of cooking, which might be different from what they were initially used to. And then, let me find here. So this particular project is funded by the lady that Nikki also mentioned, Diane from the US, and we're incredibly grateful to her. And just to kind of give you an idea, like on average, our 2 coaches at the clinic sees more than 100, almost 150, potentially up to 150 patients or Eat Better South Africa participants at the clinic. And then we've seen some significant reductions. And I know it's early days, so I will not go into it too much, but reductions in like random glucose testing, the weight, the waist circumference, the average has got, like I'm looking here at some of the averages that has gone down, which all of these markers, as well as every single one. We're just waiting for the new HbA1cs, but random glucose, weight, waist circumference, and blood pressure, all of these markers has come down. And we're now, I think, at the 6-month mark, I think, these results are from. So it's absolutely amazing. And I want to add to that something else that we're very excited about, because obviously, research, it's expensive, right? And what we've now also done is we've actually applied for ethical approval for a kind of an ongoing data collection of our Eat Better South Africa programs. And we are in the process of, it's not there yet, but I'm putting it out there. So if anyone's interested, let us know. Formalizing a volunteer program for Eat Better South Africa, where we would like to, we would like to empower and upskill and train volunteers around, I would say, South Africa, but obviously, please also globally, and try and gather more data through for this specific study. So obviously it will be quite intense in the sense of what we need, how it will be done, and so on and so forth. But it will really help us to get the research done so we can have a bigger pool and show, look at what is happening. Because like Nikki was saying, literally within a week, the changes that has happened for some people. And I mean, she mentioned the blood glucose, but I mean, just blood pressure. We had a lady, and I can't remember now exact name, but I'm sure Nikki will remember who I'm talking about. There was a lady that came and she had very, very high blood pressure. Like we were like, okay, you are going to go to the EC, the emergency clinic now. Maritza was also there. So Maritza she also often joins, and she's a trained paramedic. So she's always the one that's saying, so your blood pressure. And this lady, we said, well, you need to go to the emergency room. Your blood pressure is so incredibly high. It's like it's a hypertensive emergency. And she said, well, I've been to, I think it was Somerset Hospital in Cape Town, and I've been there for 3 days. No matter what they did, they could not get it down. This is just my life. This is normal. This is my normal blood pressure, right? We got one of the nurses, again, very thankful for the incredible staff at the clinic and at the emergency room. One of the nurses came to speak with her, explain to her, and so on. And, and we, again, we had our session and spoke. And I think it was a week later she came back. And I can't remember the numbers now from heart, but it's almost like getting up from a wheelchair. Like how much her blood pressure reduced from 1 week of making dietary choices, just 1 week. And I'm getting literally goosebumps as I talk about it, because I mean, it's one thing to share these stories, but again, I wish I could show everyone. It's so different if you actually experience it. You're muted, Jayne.
Thank you. For me, the years of Eat Better South Africa, obviously there are these data sets that we look at and we go, wow, we look at a graph or a chart and we think, holy moly, this actually works on a bigger level. But it's the people. It's those stories of people that have come to me with tears in their eyes. It's the lady in Lavender Hill that came to me with 100 Rand notes donating to our campaign. And she had a single mastectomy and she's been suffering from breast cancer for a decade. And this changed her life, this program. And she had so little and she was donating. It's the faces and the tears and the stories that are just so hard to believe. And I think one of the things at Nutrition Network that I realized, many of you that come to us and come to our community come to us because you've lost hope. And you've kind of given up on, your medical degrees where you learned a certain way of doing things, and you've worked with patients for maybe years or decades and not seen results. And it's kind of like you've been stuck in the cycle of medication and like imminent death with many people. You're just watching them get worse. And then suddenly something happens and there's this twig and a patient comes to you with a complete reversal and you can't believe it. I'm thinking of you, Andrew Aswari, if you're here, amazing doctor that is one of our practitioners in New Jersey. His patient got him onto the low carb approach, and then he thought, holy moly, like I better check it out. And then he reversed his type 2 diabetes, and then he did all our trainings and certified because he just couldn't believe it. And it's like the Damascus moment where suddenly your Pandora's box has been opened and you can't look back. And we go into these clinics and we're so used to working with medical professionals that say like diabetes is an irreversible condition that's degenerative and you're just going to get sicker for the rest of your life. And Nikki, you nodding because you've lived this story. I guess we're just told by many that like it was never going to change and you were never going to get better, and this was your future, was just more and more medication and a wheelchair. And here we are looking at these incredible changes in people's lives. So I wanted to talk quickly while we're on research, just a little bit. Jana, you said research is expensive, and you're right. I mean, it's bloody almost unaffordable for a small organization. And that's what's so interesting, because research is seen as this thing that has to be such a big story. And we sort of go for the gold standards. And I'm Eric Westman. I really respect and love your work. And you always talk about it. I think you say it's 100 people, 3 months or 6 months. You've got a criteria, a formula that you use to skim out other research. And of course, what's emerging globally in the world now is what's the N equals 1, the anecdotal movement. And when I look back at the history of the Noakes Foundation, we actually didn't really have a budget at the beginning in the early days. We found money for some important studies that were big, kind of more clinical trial things at Sports Science Institute at the time, headed up by Dr. James Smith. And those were years of incredibly expensive research on small numbers. But what we did because of that was we said, like we did with Eat Better South Africa, we said, we can't wait. We're just going to try something anyway, as long as it's kind of ethically aligned. And we ran our first program as a pilot. We called it a program. It wasn't an intervention because that's a research study. It was a pilot of a program, and it worked. And we started to gather our data. And I'm talking to you out there, wherever you are in the world, where you've got data and you're frustrated and you've got patients and you want to build this into something. And we started somewhere. And then what we did was we did a few other pilots on food. And the particular one that I want to talk about is, obviously you've talked about now the pork study that you've actually got proper, good, solid funding for as a foundation. And then later on, maybe the egg study. Now, where this began, we go back to almost 10 years. We decided that there was this amazing new mealie pup, or pup, which is a porridge, a South African community porridge in South Africa called Heba pup at the time. And we wanted to show that it worked. And so we took a bundle of things. We called it the breakfast study. And we took a bundle of products that Diabetes South Africa said were diabetes friendly. And we took Heba pup. And we gave them to type 2 diabetic patients in a kind of clinical way through one of our medical professionals' practices. And patients with type 2 diabetes took this. And then we started to build our own data sets and go, holy moly, look at the charts. Spike, 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 except for Heba pup, flatline. That's where it began. And it evolved into years later, and many, many versions of blood, sweat, and tears and different proposals from the team. Layana, I'm looking at you. It evolved into being funded by the macadamia industry to do an incredible study on comparing macadamia, coconut, and olive oil on quite a big group of patients, and looking at their bloods and doing a really, really in-depth, beautiful study that was intel for an industry. And it evolved and evolved. So I encourage you, a lot of you, particularly practitioners, come to us and say, like, I want to do research, I want to publish, I have to do the gold standard. Start somewhere. Like, start with what you've got, start playing around with the data that you have access to, start building yourself, because eventually 10 years later, in a blink of an eye, like it has been for us, you will be an established nonprofit organization or research entity. Come to the Noakes Foundation and work with them. They are very tactical, creative, incredible. And one thing that I know for sure, because I've seen this many times, is that doing research in South Africa is probably between 4 and 12 times cheaper than doing it in other countries in North America and in Europe. And the foundation is an incredible like a place to come and commission research that you would not be able to afford in North America or in places where research and data studies are very expensive. So I'm just saying it here because we have world-class research facilities, world-class medical screening and kind of ethics approval processes. It's an amazing place to come to. I'm looking at Jana again, come to the TNF team and say, we've always wanted to do this, and maybe we could do it through your labs and through your programs and test certain things in a new way here. So just don't forget about research and how important it is. But really at the heart of this, just to bring it back, is that we are wanting to give thanks. And we're wanting to say, how can we help? How can we do better as a community, as a country, as a medical practitioner community within the Nutrition Network? How can you help those of you that are listening? So to answer that question, I want to ask you, and please, I haven't said already, please drop in where you're listening in from and what you're doing this Black Friday. That's okay, sure, maybe many of us are shopping, I'm not going to lie, I did order myself yesterday for something, but I'm trying to give this year. So what are you giving back to this year? What charity or cause are you going to support? Hopefully it may be, Nutrition Network, TNF, not Nutrition Network, but one of the trainings that supports a charity. And I just want to list those so you're aware. So the Noakes Foundation is a majority owner of Nutrition Network. So anything that you buy through us, there is a percentage that goes to them. But then there's this Eat Better South Africa training that you can actually donate. That is almost all the money there goes to them, other than I think a small fee for administration. That's one way. You can just donate money. Jana, you're going to talk about this afterwards, but I'm going to just run through the other places within our universe that you can donate and give back. So anything that you order as a Nutrition Network person through the Society of Metabolic Healthcare Professionals, which is also a nonprofit in the US, it's a 501c, that also gives money towards them. There's quite a big percentage that goes towards their cause and funds their organization. So that's a wonderful way to give back. Then if you buy the training by Dr. Sarah Holberg, which is a free training, but when you check out through the Nutrition Network, you can make a donation and you can choose who you donate to. And that funds the Nutrition Coalition, which is something that Dr. Holberg's family chose as a recipient of the money generated from her legacy. Or you can choose, I think it's the SMHP as well, or you can choose the Noakes Foundation and Eat Better South Africa. So you can make a relatively large or small donation through that free training to one of these incredible organizations. Another way you can do it. Also, if you buy through the Public Health Collaboration, one of our trainings, they're also an affiliate. They're also an amazing charity if you're UK based and you want to support them. So a lot of ways that you can get something and up-level your education and also do good and give back through this Black Friday if you want to, or you can just donate to one of these many causes, or let us know what you are donating to, what new charities are coming out in the low carb space that you might want to be supporting, that you feel are making impactful work. We're always looking for new places to figure out how we can work with them and share knowledge. And Jana, what else? Tell us. I said I was going to come back to you. What other ways people give to the Noakes Foundation?
Well, if you go to our website, www.thenoakesfoundation.org, right at the top right, there's a little button that says donate. So there's quite a few options listed there if you want to make a direct donation. You can do legacy donations. We've had some incredible support this year where people would, one example is someone had, I think it was their 50th wedding anniversary. And instead of gifts, they asked everyone to donate to the Noakes Foundation. That was amazing. We now have someone's 40th birthday coming up. And instead of asking for gifts again, they're asking for donations to our organization. So if there's anything like that you want to do, instead of maybe Christmas gifts, you want to give the gift of better health. That is also definitely options. Jayne, I love how you mentioned the studies earlier, because I want to say again that also helps fuel our research. So if there's anyone out there who wants to collaborate on research or want to do some studies working with us, it would be great. This year we were working on 7 different research studies. And I remember Karen Heath, our senior researcher, she's absolutely incredible. She presented this at the World Nutrition Summit. Briefly, she went over them. And I sat there and I think I actually told you afterwards, Jayne, I can't remember. I said, like, oh, wow, some of this almost feels unreal in terms of how far we've come and how far the work of Professor Noakes has come and the impact his legacy has had. And then obviously, if anyone wants to just collaborate in terms of you would like for us to come and do a workshop at your work, or whether in person, whether virtually, if you maybe work for a charity organization and you feel like this is something that could slot into that, contact us, reach out to us. There's many ways you can do that, but either you can email myself, it's Jana at the noakesfoundation.org, or just email us at info@the noakesfoundation.org. We are also, I always say, we're open to suggestions. So maybe if there's something anyone else there thinks of that we haven't mentioned, Jayne, that's also an option.
I mean, I think that's an important one, is, just like how we can give back in ways that are creative. How can we do this if we know what our cause is? If you're listening to this, you probably know what your cause is, and you're probably quite aligned with us. Maybe not. Maybe you just bumped onto my page and saw the live. What the hell are these guys up to? But find something. My invitation to you this Black Friday is to find something that's meaningful and matters to you, and spend your money carefully. And I've always believed that. I was very inspired by the late Anita Roddick, who was the founder of The Body Shop. And that was always her vision, was that we could have profits with principles. And that's always been the vision of the Nutrition Network, was to find something that was viable and would grow and would be a support and would offer something in the world, as well as giving back. So I've always wanted to spend my money on things that support principle in some way. And that's not always easy to find, of course. There's a lot of brands out there, like the Fair Trade chocolate brand. So if you're buying Fair Trade chocolate, great. Maybe it's giving back, but just watch the sugar content. So Nikki, I just want to come back to you, because you've got so many important, and you've got such a lot to share, and we've kind of focused on a lot of the other stuff. I mean, just tell us about, if somebody actually get access to an Eat Better program, if they're in the mainstream clinic story and they're in the journey that you were on in their lives, and then they step into an Eat Better program, what happens and how can it change things for them? Like, what is their life like before living in a local community or a local township, and then moving into it's not going to change, of course, their life, but what does it change for them, and how can we help South Africans that really are living on the breadline and struggling with their health so terribly? Can we make a difference?
Yes, we can. So the first thing that we do is we have support groups. We have our WhatsApp groups, and also, like Jana mentions, we have other Saturday sessions, like once in a month, that we do. But initially, when we talk to the patients at first, we try to explain to them that, okay, like changing your lifestyle is not expensive, because mostly people they are hesitant, because they feel like, if I have to change, then it means that I have to spend more money on the food and other stuff, so they won't be able to afford it. So what we normally do is we try and reason with them. So we sit with them for 30 to 1 hour or even more. So we have a one-on-one discussion where we explain on the other alternatives that they can choose from. Like, if they are going to buy, how can they buy smart? How can they set their goals and stuff? So after our initial meeting, we do a follow-up via WhatsApp. And sometimes there was another one who was saying she's staying far, so she won't be able to come to the clinic on a weekly basis. But she does come once every month just for a checkup. So we normally talk over the phone. So if she's not sure of what she wants, then we okay, what can we choose? Let's check online. What is on sale? What can you eat? So those are the other things that we do. And the other thing also I forgot to mention about it is I also have like my own program on the side also. Is it's just like promoting the things that we do here at Eat Better South Africa. So there are some people in Zimbabwe as well, and they can't afford to buy their medication. So what we normally do is there was an old couple that I was talking to over the phone. So I managed to tailor down the meal plan for a week, and then I sent it over to them. So the first time their husband's sugar was on 23 and the wife's one was on 17. So after a week, after I sent her the meal plan, their wife's sugar was on 6.2 and the husband was on 5.5. So that was something that is incredible. And knowing that they're coming from a low income area and change, they managed to make a big change like this. So it is something that is like motivating. And also here in the noon, like most people, they can't afford to go and buy like all those organic stuff and stuff and like from the fancy shops as well. So we're like, okay, let's do what is on the ground. We have ShopRite and we have Boxer. What can we choose? Well, that is on the LCHF diet. So, and also the
Amazing.
green list has been.
Oh, Nikki, we lost you there. Oh, no, you're back. You kind of muted yourself. Oh, no, you're there. Amazing, Nikki. Thank you. Wow, yeah. I mean, there's so much to unpack. I feel like we need a whole live now. We haven't even got to the actual training, and we're not going to have time. I wanted to actually talk through what's in the EBSA training, but it seems like it's just been so whirlwind and quick. And I see we're now almost on the hour. And I also have to apologize to all of you lovely listeners that have joined, because thank you, Tamsin, for just pointing it out to me. I was on the wrong tab and I never saw all these comments that were coming in that are so interesting. So, Rena, thank you so much for all your great points. Hi, Maritza, you're there. Teresa thanked Nikki and actually got up and moved while you said that. So there you go, inspiring people to get out of their chairs or wheelchairs and start to move again. None of us will ever take it for granted after your story. And then Tamsin's asking about the Sarah Hallberg training and is it connected to TNF and EBSA? So it's not directly connected, no. So this was a training, just for those of you that don't know the story, the incredible late Dr. Sarah Hallberg, who changed so many lives and was like someone also to just give thanks to. Phew, difficult to talk about because we all had such a loss when we lost her in the community, and we miss her and her powerful voice and wisdom and mind. She did a training and put together a body of work that was for practitioners before she passed, and her family asked us to host it under the Nutrition Network, which we did as a pro bono activity. And the intention of it has always been for it to be free and of no cost. So it's available for free, but when you do sign up for it and when you check out, there is an option to donate to a charity, and the charities that you can choose from are, I may be wrong, but I think it's the Nutrition Coalition, which was Sarah's choice, and then the foundation, which was kind of our choice of where we would donate things. And there's a chance there might be other charities in there, since I haven't checked for a while. So when you check out, you can obviously just get it for free, or you can give back in that way. And I believe it's uncapped, but it may have like numbers that you have to choose from. So just if you do get access to that training, if you haven't, please watch that training, anyone. It's extraordinary. And it's really like a manifestation or a summary of her vision for the future of healthcare, which I think we're now in to some extent. So another person to really send so much gratitude towards and thank. And another one, which I just want to mention before we wrap, is also the late Daryl Folks, who was an extraordinary man that came to our first program at Eat Better South Africa, which was then called Nothing. We didn't even have a name for it, in Ocean View, so we called it Ground Zero. And it was on the first day of the training, there were about 60 women appeared. We couldn't believe it. We thought like 5 would show up in the community hall in Ocean View. Thank you to all of you. You're so special and precious to our hearts, and many of you are still friends, of course. And there was one man, and his name was Daryl Folks. And tricky because like how's it going to work with one guy? But he really was very visibly suffering from morbid obesity and all the comorbidities that come with it. So we thought, okay, well, he's got to be in here. And he was one of the highlights of the program. I mean, he lost so much weight, I can't even remember how much, but not even that. He was just the joy. He then stayed on. At one point, he was a community coach. He was always our DJ. I mean, he was the best DJ. He always did our sound for us. And tragically, he succumbed to his disease. And it was a huge loss for us because he didn't make it, and it had the potential for his life to be reversed and to walk this path was, of course, so great. But that was very early on. It would have been different now because he would have had a clinic to go to for these programs to treat. So I just wanted to round up by just thanking each of you for what you do every day, your passion, your stories, the new vision that you bring into different areas. It's immense. And it gives me the biggest amount of pride of my lifetime to know that like this is going to grow and continue in this way. Eat Better South Africa and the incredible work the foundation does. And then to just expand that and to just thank everyone here that's watching and our Nutrition Network community, many of you that have walked this journey with us from the very beginning and that saw and believed in us and the vision that we had and the potential that this had. And look at where we've come. Look at how far you've come. And give thanks in every way that you can to yourselves, to those around you, and to the organizations that are meaningful to you. Any last roundup words from either of you? Just as a gratitude. What are you thankful for this Thanksgiving? Let's go there.
I don't know. Nikki, do you want to go first?
It's quite a big question.
Yeah, I mean, I feel like I need to prepare for this. Oh, gosh. Okay, well, I think if I have to, I would say for connection, support, and relationships.
Lovely. Thank you,
I think
Jana.
I'm not going to elaborate, but those are the things that I'm thankful for.
What are you thankful for, Nikki?
Finally got my legs back on my feet, like I could walk again. And I'm also thankful for being a part of someone's life, transforming someone's life, like changing from their old lifestyle into a new healthy lifestyle. And I'm also thankful for meeting Jana as well. She has been incredible. And also for crying with you, Jayne. I'm also thankful for that.
Thank you. Thank you both. And one last thank you from my side is that I met and that the life and legacy of Prof. Noakes. I mean, just the most immense gratitude to him for his courage. And then to each of you that are here, and I can only mirror you, Jana, community connection, relationships. That's what we're here for. That's what makes us great. So blessings to each of you and to each of you that are listening. Thank you for joining us. Thank you for sitting through some of our stories and our news and this sharing. It feels so important on Thanksgiving. And have a beautiful Thanksgiving further. And write to us if you have any questions. Thank you both so much. Bye-bye.